Today, the Kingdom of Eswatini entered its sixth day of the partial lockdown initiated to halt the spread of the coronavirus. With 850,000 confirmed COVID-19 cases and 41,000 deaths globally, this virus is proving to be among the biggest health challenges the world has faced in many years. This is a highly contagious virus that has the tendency to spread like wildfire across communities and countries. Eswatini remains with 9 confirmed COVID-19 cases and at high risk and high alert. The kingdom is currently under a status of national emergency. The decision to activate a partial lockdown was crucial in flattening the curve and ensuring that the number of infected does not balloon to overburden our already strained health system. The past 6 days has been a period of many lessons with false starts and uncertainty in some instances as Eswatini adapted to a change of lifestyle never experienced before. I take this opportunity to thank all citizens who have heeded to the call to stop unnecessary travel and stay at home in adherence to the partial lockdown measures. Experience from other countries has taught us that there is no better intervention to restrain the spread of the virus than to keep it contained in one place instead of spreading from community to community. The virus does not move in itself, but people move it and thus spread the risk of infecting others. The partial lockdown allows us to travel only for food supplies, medication, and the workers in essential services. All other travel remains strictly prohibited. May I take this opportunity to appreciate His Majesty the King, King Mswati III and Ingwenyama, for his incisive leadership and direction at this challenging time, and for calling for a national day of prayer which was successfully held on Sunday the 29th of 2020. Thousands of Eswatini in and out of the country joined the prayer through broadcast channels and government social media platforms. As a nation, we have no doubt that through prayer, all things are possible. My appreciation also goes to the Deputy Prime Minister for the role he has played in effectively leading the national emergency response. The National Emergency Task Teams, regional and sectorial committees have accepted this responsibility with speed and commitment since the national emergency was declared. Government continues to pursue all avenues that will lessen the negative effects of this partial lockdown on the pockets of the populace. To cushion Eswatini from the economic impact of this period and the devastating effects of the coronavirus, government has made several interventions. These include the central bank has reduced the discount rate by 100 basis points. This reduces the cost of debt by 1%. Government has reduced the price of fuel with effect from midnight, the 2nd of April 2020. The increase in the price of electricity has been suspended for 2 months. The renewal of motor vehicles registration has been extended without attracting penalties to the 29th of May. Taxpayer projecting losses are expected to file loss provisional returns and no payment will be required. Government is engaging the transport sector with a view to assist with a small subsidy to ensure the industry to continue transporting workers in essential services and citizens embarking on essential travel. We are thankful to the cooperation we are getting from the transport industry in this difficult period for them and business as a whole. Government further appreciates law enforcement agencies for ensuring that the public complies with the partial lockdown measures. May I emphasize the importance of allowing only essential travel and essential businesses to operate. We are cognizant of the massive economic impact that this partial lockdown will have on business. This decision was not taken lightly. We are called upon to prioritize the health of our people at all times. No one will work in these businesses if eMaswati would succumb to this virus. The lives of all eMaswati matters and cannot be compromised. We therefore plead for patience and understanding as we traverse together through these difficult and challenging times for our economy and country. It has been observed that whilst the virus does not generally discriminate in terms of age, it has the tendency to substantially affect the elderly and those with underlying health conditions. Therefore, it is important for government to protect our elderly from being exposed to this virus, especially in the issuance of the elderly grant, where large numbers of people gather at one time. Government has taken the decision to pay all elderly grants electronically with immediate effect. This is done in collaboration with the Eswatini Post and Telecommunications Corporation, MTN Eswatini, and Eswatini Mobile. The distribution of grants is going very well so far. The elderly are very appreciative of this initiative, and clearly this is a significant step forward towards Vision 2022. Government has also approved a preliminary costed procurement plan for the COVID-19 Eswatini National Emergency Response after wide consultation with stakeholders. The resource mobilization team has been able to raise 18 million emalangeni towards the COVID-19 response. This would not have come at a better time, as financial resources are urgently needed to produce more health equipment and material so desperately needed to effectively manage the spread of the virus. An assessment of the overall amount of financial resources required to fight this pandemic is underway, and the public will be informed. To this end, government fully appreciates the generosity of all our international friends and local companies that have already donated towards the response. To cope with the demands of halting the spread of coronavirus, government has recruited several health personnel. They include 8 doctors, 145 nurses, environmental health specialists, paramedics, orderlies, and others. A total of 1,007 nurses from all levels, 147 medical doctors, and over 3,000 rural health motivators have been trained on COVID-19. Training is an important element in the fight against the virus and will be an ongoing exercise. Our rural health motivators are crucial in reaching out to the communities and helping with the required information to stop the spread of COVID-19. 40 water tanks with a capacity of 5,000 liters each have been procured and distributed to various communities in the country to provide running water to wash hands. The priority has been rural areas which are experiencing water shortages. We are aware that this is not enough, and government continues with the program to bring clean water closer to all Eswatini. Government is in contact with Eswatini in high-risk countries, ensuring their well-being and safety at all times. This pandemic continues to test our resolve as a nation, and we have the opportunity to leverage on its effects to uplift our communities. Once again, let us be all vigilant and follow all the partial lockdown measures and health precautions as provided by the Ministry of Health and the World Health Organization. The public is advised to reject myths and conspiracy theories that seem to dominate the social media platforms. As we observe the partial lockdown and restrict unnecessary movement and stay at home, let us remember to follow the precautionary guidelines as provided by the Ministry of Health and the World Health Organization. Our home environment should be kept clean and safe, and all high-touch surfaces must be disinfected regularly. Wash hands regularly with running water and soap. Help the young to also appropriately wash hands. In the absence of water and soap, the public is advised to use sanitizers. Stop shaking hands and use other non-touch methods of greeting. Maintain a distance of at least 1 meter from each other. Avoid touching your face, your mouth, your nose, eyes, and cover coughs and sneezes. Take care of the vulnerable, especially senior citizens and those with underlying respiratory conditions who are more susceptible to the coronavirus infection. If you experience flu-like symptoms, fever, difficulty breathing, cough, high temperature, visit your nearest health facility or call the Emergency Medical Services toll-free number 977. The message is clearly: stay at home and save yourself, family, community, and the country. Thank you. Nine bekunene namuhla live la Kangwane selingena elangeni lesithupha solo kumenyetelwe ukuthi live liku partial lockdown lala khona abantu bakhutsatwa ukuthi babe semakhaya kuze ukuthi kutovikeleka ukuthi kwanza kwalesifo noma ke lomkhuhlane lesibhekene nawo silive. Lo mkhuhlane ke lo thelelwana kalula nalogijimako ugijimisa kwemlilo wasendle. Live ke la Kangwane bekunene solo line bantu labangu 9 labatholakala ukuthi banalo leligciwane lesingakusho nje ukuthi lo wekuqala lo watholakala bekunene sowuphilile sowubuyele usekhaya okanye nemndeni wakhe. Siyaqhubeka ke siba sesimeni vele lesisetulu ukugatsa lesimo bekunene njengoba kwamenyetelwa emavikini laphelile. Lesinyathelo ke lesathathwa bekunene ukuthi sibe ku partial lockdown simcoka kakhulu ikakhulu kuthenini lo mkhuhlane unganzi kakhulu bese kuthi abantu abaningi even baba nalomkhuhlane ngoba utabe sewesinza tempilo noma ke litiko laka health i-health system yethu ngeke ikhone kuwethwala lo mthwalo uma ngabe kuthiwa sonke sesiyagula siphethwe ngilomkhuhlane at the same time. Kungako ke kunalo ukuthi asihlale vele emakhaya kuze kuthi hulumende ne-health system ingeke uthwala umthwalo lomkhulu kakhulu. Singasho ke bekunene ukuthi kulamalanga lasithupha lesengcile solo kuphakanyisiwe lokho ukuthi asihlale emakhaya bekunene sibonga nje ukuthi eMaswati alalele sibonga yona inhlonipho bekunene ekuthenini eMaswati lamaningi vele ahlete emakhaya ngaphandle kwalabo lekumele baye emisebenzini lefanele bekunene sithi asikubonge lokhu sikudumise bekunene ngoba kutaliphilisa live nekulandzela nje yonke lemigomo lethuliwe esiveni. Emaveni ke lalwe nalomkhuhlane cisha abonakala aphumelela bekunene vele aphakamisa loluhlelo nje loluphakamisiwe lolufana nalolu bekunene lwe-lockdown noma i-partial lockdown noma i-full lockdown kodwa nje lo mkhuhlane vele kubonakele ukuthi kuleti ndzawo lapha baphumelele khona kuncoba bethula loluhlelo lolu esiveni. Sithi ke bekunene leligciwane lide tinyawa lihambi kodwa bantu labalihambisako uma uhamba nje uya esicukwini la kunebantu abaningi khona uthinzana nebantu kulula ukuthi bese soyabathelela lo mkhuhlane nabo bese bayagula. Kungako ke kwethule lo hlelo bekunene lwayo le partial lockdown lokuthi sihlale emakhaya ngaphandle ke ukuthi kube ngilabo labaya emabhizinisini lasasemile asebenta noma ke la kuthengwa khona kudla titolo tivuliwe ama-supermarkets nemagrosa avuliwe netindzawo temtholampilo netibhedlela tivuliwe bekunene. Lokunye ke lokungathingakali kumele vele ukuthi singakuhambeli bekunene sihlale khona emakhaya. Uhulumende wembube nesive sonke sithandza kubonga kakhulu kuyo imbube yemhlaba ngekukhombisa buholi lobusecophelweni lolusetulu kakhulu kukhombisa live ukuthi kulesimo lesiphethe umhlaba wonke siphetheni Africa ngendlela lelikhuni nalo live la kangwane isilo semhlaba sivele sakhombisa buholi ne direction lenhle ukuthi kumele silwe njani nalomkhuhlane silive. Sibonge kakhulu sikhuze libayethe bekunene ukuthi imbube yemhlaba ibone kukuhle ukuthi mhla ka-28 namhla ka-29 enyangeni lesiphuma kuyo ya March kube lilanga lekuzila nekuthandaza sifune ubuso baNkulunkulu bekunene sithi siyabonga ngoba sibonile eMaswati awulandzele lo mthandazo lobo kubonakaliswa bomabona kudze naseredweni bekunene sibonile ukuthi nalabanye bebawulandzela ngetindlela letehlukene labangekho nala Eswatini ngabo YouTube bekunene badumisa ukuthi silo semhlaba sibite umhlaba wonke ukuthi ube semthandazweni kubitwe uNkulunkulu kunxuswe uNkulunkulu kuthandazwe kuthandazela ukuthi live la kangwane livikeleke kulomkhuhlane lomubi kangaka bekunene siyakholwa ukuthi njengoba sekuthandaziwe uNkulunkulu sivile sitawuqhubeka futhi sisive sithandaze ngekukholwa ngiwe emakhosi emhlaba lavele asikhombise yona indlela ukuthi kumele sibeke uNkulunkulu etulu ngoba nguye lo ngumholi lomuhle. Sithande ke nekubonga liphini landvunankulu bekunene leliqhubekako nekhola lamabandla lehlukene kune skejane se cabinet lesebenta wona lo msebenzi wa COVID-19 kube ne National Emergency Task Team bese kuba nema regional teams la cherishwa bo regional administrator bese kuba nema sector committees. Umsebenzi bekunene sibika ukuthi uhamba kahle lawo mabandla lawo asavela yagijima ngalesikhulu sivinini kwenda lo msebenzi bekunene nahulumende wembube uyaqhubeka kubuka indlela yokuthi lesimo singabambeka kanjani kungalimali kakhulu sive ikakhulu emabhizinisini. Sithanda ke kubika bekunene ukuthi tinyathelo setithethwe nguhulumende setivele ticatha ekuthenini lo msebenzi ungesinzi kakhulu esiveni naku emabhizinisi. Libhange lelikhulu iCentral Bank seyehlisile insengo yemali ngelizinga la 1%. Uhulumende sowehlisile imali ya petrol itawuqala kwehla kusasa nekukhuliswa kwagezi lobe kumele kwenteke namuhla kube sekuyemiswa bekunene sekuyawuze kuqhubeke ngetinyangeni letimbili letitako nanaba ke labadzinga kubhalisa timoto imithelo nako lokho sekwendluliselwe embili bekunene nakulo hlangothi lwemithelo labo lekumele bakhiphe umthelo nakhona kukhona uhulumende lasakwendile ukuthi bangakhinyabedeki kakhulu. Siphinde sibonge bekunene ukuthi uhulumende asahlangene nabo bemabhasi sibabita ngokuthi transport sector tinkulumo tihambe kahle kakhulu bekunene bayaqhubeka nemsebenzi ngalolu hlelo lokuvulelenwe ngalo ukuthi batasithwala njani sive kuya emsebenzini nekuya emadolobheni lapho bawuthenga khona kudla netinto letifanele bekunene. Sibonga ke kakhulu kubambisana kulolo hlangothi nabo laba baka transport. Angicizelele ke bekunene ukuthi vele ngaphandle kwalabo lekumele bahambe ngalokudzingekile sive sibhekeke ukuthi sibe semakhaya. Siyakugcizelela lokho bekunene ukuthi sive sikuhloniphe lokhu njengoba nje sesivele sibona ukuthi bayakuhlonipha ngoba leli gciwane bekunene kumele singalivumeli ukuthi lisincobe simaswati. Lokunye ke lesigcizelelako ukuthi kuvikeleke kakhulu labadzala nalabo labanetifo letitsite letibange ukuthi emasotsha emtimba abo anciphe kumele bekunene sikunciphise lokho. Sithandza ke nekubika esiveni ukuthi luhlelo lokuholela bogogo nabomkhulu luhamba kahle kakhulu bekunene siqale kamanzini la khona cishe sesiya ngasemaphethelweni kubogogo nje nabomkhulu abale kubo 17,000 cishe lasebaholile sebale kubo 14,000 bekunene. Siyabonga kakhulu ukuthi nabo bogogo bakwemukele lokho ngaleti nhlelo la besebenzisana khona netinkampani letinzatfu inkampani lenkulu yetemaposi inkampani yaka MTN ne Eswatini Mobile ngibo laba basita ekuthini bahambise le mali iye kulabantu labadzala bekunene. Siyethembisa ukuthi itathi ngapheli lenyanga lesiqalile bonke bogogo eSwatini batabe bayitholile imali. Lokho ke bekunene kuyakhombisa ukuthi iphupho lembubo emhlaba la Vision 2022 silivele li reality bekunene ngoba uma sibuka lamanye emave sikhanza ukuthi anebulukhuni bekukhipha kuholela bogogo nabomkhulu lesinyathelo lesithethwe live la kangwane likusho kona ukuthi sesivele sisembili kakhulu bekunene. Lokunye ke lesingakubika ukuthi sesivele siqalile sakha iplani lekubuka tonke tinto lekumele tithengwe kuthi silwe nalomkhuhlane lomkhulu kangaka. Leli bandla leli ingonyama lebusise ukuthi licokelele imali eveni i-resource mobilization team seyivele icokelele imali lenganga 18 million emalangeni. Sisalwakha ke lihlelo kubuka cishe live lonke kubuka ukuthi tinto lekumele titsengwe kusita litiko letempilo lekusita abantu emakhaya sisakubuka konke lokhu uhulumende usakuhlanganisa sitakwethula nako esiveni bekunene. Siphindze ke sibike ukuthi uhulumende sovele uqashe bonesi nabodokotela labaningi nalabanye lasebatrainiwe bekunene bodokotela nalabo labasebenta kuto uhlelo lwetempilo sebatrainiwe ukuthi sitawulwa njani nalesifo bekunene. Siphindze ke ngekusitwa tinkampani saphindze sathola nemathange lamaningi bekunene langu 40 bese siwavele siwahambisile sikuyowethula etindzaweni letehlukene eveni laseswatini ukuthi bantu bakhone kuthola emanti lahlobile batokhona kugeza tandla ngaso sonke isikhathi bekunene. Sithi ke sibika lokho ukuthi lesifo vele kufanele ukuthi sisinqobe. Sichizelela ke bekunene ukuthi vele emakhaya siwagcina hlobile sihlale sigeza tandla ngaso sonke isikhathi singaqhawulani bekunene siphindze futhi siugcine umkhathi emkhathini wethu masisimile wemitha kulomunye nalomunye singatsanzi kutsinza buso lokugeza tandla bekunene kusita ukuthi ngoba lesifo sisatsalana ngokuthi sandla sithinze buso lesifo singena emakhaleni emehlweni nasemlonyeni. Kungako ke sikhutsata bekunene ukuthi nalabo labativa ngathi baphathwa ngumkhuhlane basheshe basonzele emtholampilo nasetibhedlela batothola lusito noma ke bashayele inombolo lengu-977 batawukhona kufike basitakale bekunene. Umlayeto lomkhulu lesiwethule esiveni sithi kulamalanga langu-20 labekwa kusukela evikini leliphelile laphela mhla ka-15 April sive asihlale emakhaya kuze ukuthi lomkhuhlane ungeti wanza labahambako ngilabaya emsebentini lefanele bekunene. Uma senta njalo sive sitawuphepha sitawukhona kunciphisa lobungoti lobuta nalomkhuhlane lomkhulu kangaka bekunene. Siyabonga.
Let me present the results of tests from the coronavirus disease 2019 that we know as COVID-19. The results we've received so far today are that we've had 16 people testing negative. What is important about this is that amongst them are the results of the one woman who's just passed away who was a suspected case of COVID-19. Our condolences go to the family in this difficult time. I would like to talk further about the results of that woman. This patient was admitted in one of our hospitals. It's been in the media and in social media as reported as a suspected case. She was admitted on the 29th. She had difficulty in breathing. She showed symptoms that are similar to that of COVID-19. It is true that one of the nurses wanted to seclude herself because she was afraid to work with her. However, she was helped and she was isolated and she was treated and tested for COVID-19. So amongst the results I'm announcing today, amongst the 16 is her results. She tested negative for COVID-19. She was 33 years old. She had an underlying condition from October last year when she was first treated at Mabane Clinic. She had been treated throughout that period to now. I am announcing this because it has appeared in the media, it is appearing on social media, and we would like to clear all the myths and around the issue. She was ill, she was treated, she was tested, she was negative, and we would like to pass a message to the country that the Mbabane Clinic did everything they needed to do, even though there was fear amongst one of the nurses. I would like to encourage all health workers to continue working hard, protecting themselves. We recognize that there is always fear because this is a new disease, and nurses and other health workers are concerned for their own safety. There are protocols. People should follow the protocols and protect themselves and help the nation. The second issue I would like to address today is that of the people that are now free of the coronavirus. His Excellency mentioned that what we refer to as our case zero or our patient zero, the first person to have been tested, positive in the country, she's now been discharged home. In the treatment, once you test positive after treatment, negative after treatment, we test you again. And when you test negative, then you are free to go home. What is really important is that these people who have gone through the disease, who have suffered through the disease and have conquered and are on the other side, they actually have developed immunity in their own bodies. It means that they can go home, they are safe, they are not going to infect anybody. As a Ministry of Health, we would like to encourage families, friends, and communities to welcome people back. Because of all the people we should be concerned about is those people we do not know of their status, whether they have the disease or not. If you've had the disease, you have developed immunity, and you now test negative, it means that your body has developed the necessary antibodies to fight against the disease. So you are safe to everybody else. We do realize that there is fear, that there is concern, that families are concerned, but when we test anybody and they go for treatment, we go to test the family, we go to test any contacts that they have had, and we make sure that people are tested and are treated accordingly. So we do very strongly encourage families, we encourage friends, we encourage the nation that in the next few weeks we are going to see more and more people testing positive. We are going to see more and more people who have a mild form of the disease, as we've seen so far, recover and go home, that it is okay for people to be back home. It is okay for people to be welcomed back into their families and into their lives. This shows us that people can overcome this disease. We do know that over 90% of people are going to have the disease and they're going to recover and they're going to be fine. So the nation should continue to watch themselves and make sure that we welcome people back. As a ministry and as government, we would like to continue encouraging the nation to stay at home. Let us not move the virus. Stay at home as much as you can. At home, make sure that you wash your hands with soap and water frequently. This is to make sure that if you've touched anything where there might have been an infection, you will not infect yourself. Keep a distance from other people as much as you can, and make sure that you cover your mouth and nose when you sneeze or you cough. This is to prevent you infecting other people. And we would like to continue to work with the nation in preventing this disease from spreading across the nation. So please stay at home. Please distance yourself from the next person. Please keep safe for your own sake and for the sake of everybody else in the nation. Thank you very much. Lamuhla results esiwatholile ebantfu laba bene coronavirus of 2019 lesiyathi nga COVID-19 babe 16. Bonke labantfu laba testwe lama test lafike lamuhla ba negative. Atawuchubeka ema test kodwa kuze kube ngalesikhathi lesiwatholile ang 16 bonke ba negative. Lokubalekile kulama results anamuhla ukuthi ukhona munye losashonile lobekasolwa ukuthi angahle abe nalo leligciwane le coronavirus 2019 COVID-19 abe kulesinye sele dibhedlela tethu la eMbabane wangena khona mhla ka 29 le ngithanza ukudlulisa esiveni sidlulisa umlayeto ku family yakhe kusisi simadudu bekunene nidududeke uNkulunkulu aniphe amandla ukuthi nedlule kulesikhathi lesimadima. Lona bekana 33 yeminyaka. Abede le history lethi utsinzene nalomunye lo ngabe ube naso lesifo kulamaviki lamabili noma lamathathu laphelile. Kodwa ke yena abenegula tsite lekwamletha esibhedlela kusukela ngaOctober welashwa waphinze wabuya njengoba abuyile njena wakhanzakala ukuthi timpawu khombisa timpawu letinjengalokhu kwale coronavirus kusho sibekane timpawu tekugula kufana nalokhu kwa coronavirus base bamsita ke esibhedlela bawumbeka egumbini lapho abekwa khona welashwa watestwa kulama test labuye lamhla kukhombisile ukuthi abede i-coronavirus abenegula tsite lokunye lekalashelwe kona. Lokunye lesithanza kukhutsata ngako sive ukuthi kulabantu laba-9 labatestiwe batholakala abapositive njengoba sekashita uNdunankulu lo wecala sowuphilile sowusekhaya. Uyazi umnakelashwa ave attestwa nalo wesibili newesithathu nabo sebatesta negative nyalo kusho sinabo batahamba bakhululeke babe sekhaya baphile nemindeni yabo. Lesicela kwesiveni nalesanza kwedlulisa esiveni ukuthi phela loyo losalashiyo losabe nalesifo welashwa waphuma kusho umtimba wakhe sowutakhele lamasotsha okulwa nalesifo. Lo muntu lo esoyakhona ukuthi ahamba besekhaya abiyele nasemsebentini ngabo buyele emsebentini ngoba akasenawuthelela muntu lesifo. Umtimba wakhe sowunalamasotsha sowude lesifo angeke asanthelela leso sifo. Siyathi lokuthi kunekwesaba ngoba sisha lesifo. Kunekwesaba kubantu ukuthi hey utawubuya asithelele utawubuya kube njani. Siyathanza kugcizelela esiveni ukuthi bantu batawuphila labanengi bethu sitaba naso lesifo. Labanye batawuphila nje bangikaye esibhedlela, labanye batawudlula esibhedlela baphile. Kodwa nababiyele emuva emakhaya sibemukele siphile nabo njengoba besiphila nabo. Lokhu kumlayeto lobalekile ngoba akufuneki bese sibandlulula abantu sibuke ngathi lesifo sekunjani la lesebedlule kuso ngibona mbambale seba safe ngoba sebedlulile umtimba yabo seyiyakhona kulwa nalesifo. Siyachubeka ukucela esiveni nokugcizelela esiveni ukuthi asihlale emakhaya sendele ukuthi singasihambisi lesifo. Siphinze sigeze tandla kanengi ngelanga ngemanti lahlobile nensipho. Sikhwehlele sivale timphumulo nemlomo ukuze singatheleli labanye abantu. Lapho sihleti khona nasikhona sibe khashane nayo singasonzelani ngoba kulapha ekuthinzaneni lapha singahle sithelelane lesifo khona. Sisachubeka ukuthi sizame kuvikela sive ukuthi lesifo singanzi. Siyagcizelela siveni, siyacela ukuthi abantu bahlale emakhaya, labo labasemisebentini bakhumbule kwenda lokho lokubalekile ukuthi bakwende ukuze sivikeleke sonke. Siyabonga.